So we've organised this day because we want the clinical matrons to continue to work as part of a cohesive team, to learn some new clinical skills and to think about the opportunities it will provide in terms of their own teams, taking their learning back to the workplace, but also potentially their teams coming to come and work here as well.
Go.
It's actually very close to the real thing. The models, particularly with the sepsis role, they breathe, they blink, they speak to you. So it's probably as near as we're going to get without practicing on a real person. And it gives you an idea of how you might feel in that moment. Even though it's still in a training situation, it can still make it very real to you as well as to what you're doing for the patient. It's been a great reminder of things that I thought I'd forgotten, but actually it does come back, all those clinical skills that I'm not used to, my present role I don't use very often, and just working with the other matrons is very, very valuable.
Okay, let's put it up to 4. Okay.
So it's our clinical matrons from all of our specialties who've got a complete range of clinical workstations to work in, so sepsis, transfer, looking at the amatage and doing some communication skills, also looking at patient empathy in certain groups of patients, and we've also got a couple of our clinical skills educators here.
What does the first question ask me? I can't see. It's good because none of us are perfect. We've all got learning to do, and by going through clinical simulation we can look at what our strengths are, but also the areas of improvement that are required for not just for us as individuals, but for us as a collective group.
Cultures, and I'd also take an arterial blood gas as well, so I can get a lactate, so I can see.
So I think the value that you get for today is that you can practice some of the skills that you don't necessarily use on a daily or maybe weekly basis in a safe environment. I'll take away from it today is how we can use this in the future and how we can look at supporting our staff, that we can maybe upskill. And so today has been about utilising those skills and amalgamating those and learning from other people as well.
Silver fibrous dressing.
So we're going to put
Absorbent.
I want them to understand how their students work and how their students learn currently, and the environment that they learn in. I want them to take the skills back to their staff, to share those learnings and skills, but also potentially to think about how they could utilise an environment like this in the future with their own teams.